Hello and welcome to Healthy Living, brought to you by St. Tammany Health System. I'm your host, Melissa Hodgson, and we're talking today about the community health programs that St. Tammany Health System is a part of or has to offer. We'll first speak with St. Tammany Health System CEO, Joan Coffman. She'll talk to us about a North Shore-wide community health initiative called Healthier North Shore. And then we'll speak with Pablovich about a mobile health unit called the Be Well Bus. And last, we'll speak with Erin Strain, who will talk to us about corporate health solutions. So Joan, let's start with you. Welcome to the show.
Good morning.
Thank you so much for coming.
Oh, thank you for having me.
We're excited to have you in the studio. So we were talking a little bit about Healthier North Shore, and that is bigger than St. Tammany Health System. That is a North Shore-wide initiative. So can you talk a little bit about, from a big picture perspective, what is Healthier North Shore?
So Melissa, we are so excited to have launched Healthier North Shore, and quite honestly, we just launched a year ago in September of this year. So it really is in its infancy, but to see the magnitude and the impact and the momentum we've taken so far, it's just extraordinary. So what is Healthier North Shore? Healthier North Shore is really a vision that will bring people together from healthcare, government, and the not-for-profit sector. And we are focused on improving the health and overall quality of life of our area residents in both Washington and St. Tammany Parish. And we're looking to do that through areas such as education, early prevention, and certainly connecting to local resources.
Okay, so it really sounds like from all the way from Lake Pontchartrain right up into Washington Parish to the Mississippi line. We have people in our industry in healthcare, but elected officials and not-for-profits like chambers of commerce and other civic organizations that are all looking at the overall health of that population of people who are in St. Tammany and Washington. And I think we all know those numbers are terrible, but we want to get better. And so that's the idea behind Healthier North Shore.
It certainly is. And you know me, I have to start on a positive note. So when you think about St. Tammany Parish, for example, we ranked number 2 in 2020 as the healthiest parish in the state of Louisiana. That's a huge win. However, as you said, when you look at the health rankings nationally, the state of Louisiana, unfortunately, is at the bottom in the 50th position, and that's just not good enough. We really feel we have a responsibility to educate, to provide information to our public so that we can partner together with all these wonderful constituents that support our community so well to really raise the bar and move those metrics.
Well, good. And the 3 things that you talked about, the first was education. So our education committee of Healthier North Shore is focused on not just the schools, but also educating adults. And so I think if we think about that from the education standpoint, we have a tendency to throw ourselves into the school system, and that absolutely is a wonderful way to get information out. And then beyond that, also with adults, to be able to teach healthy lifestyles and healthy choices.
You're absolutely right. And when you think about the focus of this work, you know, there's a lot of resources out there. There's a lot of education that is available, but we want to work together. So you'll see kind of cross-cutting measures taking place between the 3 committees, education, early prevention, and then connection to resources. So when you think about the group that's focused on education, it's all populations. We want to educate those who are I say career, but mid-age, but also those in more of a seasoned state, as well as the youth, because the youth are really the ones that are going to help us to change the course.
Right, and so beyond education, in terms of connecting to resources and prevention and detection, there's really a flow there. I'm thinking about the community gardens that Healthier North Shore is working to bring to life. That's an opportunity to teach people about sustainable food resources, but it's also a way to bring fresh, healthy food into households.
That's absolutely right. We're very fortunate that this group has already identified a site on the Safe Haven campus to build a community garden. And what they're going to do is not just have the garden available, but invite people to come in, to your point, so that they can learn how to truly provide themselves sustaining healthy food sources.
Wow. I think that's a wonderful initiative that really, it's an initiative of the Education Committee, but you can see its ramifications in all three aspects of Healthier North Shore. Similarly, I know that the Early Detection Committee is looking at nicotine cessation, not just smoking, but vaping and chewing, that the consumption of nicotine is damaging to our whole population, and they are looking at ways to educate and to connect people with the resources to quit. And so there's another nice flow in nicotine cessation.
You know, to your point, everything crosses over. So coming back to education, you know, one of the other things that they're really focused on is, you know, healthier lifestyles. So when you think about the community garden, folks come out, they garden, they're active, you know, that makes a difference. And then you move into early detection and the work that they're doing with smoking cessation and vaping. Smoking cessation, because it still exists pretty pervasive in our markets. And we want to hit vaping because that's really something the youth has really tagged themselves to. So we're working with that early detection team to really educate on the value of not smoking and working with municipalities and government to the point about, you know, the broad array of resources we have in our advisory council to help to really set that standard.
Perfect. And so I think we've got a nice example of the Education Committee at work and the outreach. There's also the behavioral health piece of it that I think is in both of those committees, as well as Connect to Resources. And that behavioral health aspect, you mentioned the Safe Haven campus as where the community garden will be, but there are also so many other resources, including NAMI and other behavioral health resources that we can connect people to through Healthier North Shore.
You're absolutely right. And you know, unfortunately, even pre-COVID, mental and behavioral health was a concern for our area residents, and that has exacerbated with the pandemic. So we're so excited to see that not only the education team, but also the early detection teams are working hard to really improve the access to care and service in those areas. And to your point, the Safe Haven campus is a wonderful resource that we have in our community and quite honestly across the region.
That is beautiful. And I know with each of these committees and with the executive committee leadership, you have individuals and organizations represented from St. Tammany and Washington parishes. And I know that there is a movement afoot to try to coalesce this information into a website, a Facebook page, and a brochure so that each of these 50 organizations that have volunteered to be a part of this can connect the public with the Healthier North Shore opportunities.
Well, Melissa, you probably have a lot to say about that. I really want to do a big shout out, first of all, because Nick Richard with NAMI is leading the education subcommittee and doing a fantastic job and pulled together an extraordinary team to help to support that effort. Rhonda Bagby, who is with Bright Health, she really has been a thought leader for over 20 years in our community, just really helping to raise the awareness of, you know, healthy living. And then with our Connect to Local Resources, we have Chris Massengel. He's with the St. Tammany Corporation. You know, when you have a healthy area to live in, what a great way to grow the economy and really enhance our economic growth and development. So through that effort, there is a subcommittee, and they are focused on creating, as you know, an area website that will be able to be distributed probably by the end of September to the broader community so that they will know exactly where to go to connect to those local resources.
Right. Well, Joan, thank you so much for teaching us about Healthier North Shore. It's been a pleasure to have you with us.
Oh, it's been my pleasure. This is a real pearl to me for our community, both in St. Tammany and Washington Parish, and very excited to be involved.
Thanks. You've been watching Healthy Living, and we're talking today about community health resources in St. Tammany and Washington parishes. We talked to Joan Coffman about Healthier North Shore, and up next, we'll hear from Ann Pablovich about the Be Well bus. We'll be right back.
Here on the North Shore, along these halls, there are many minds at work. At St. Tammany Health System, many innovations happening now, and even more on the horizon. Many reasons we're number one.
Welcome back to Healthy Living, brought to you by St. Tammany Health System. I'm your host, Melissa Hodgson, and we're talking today about community health resources. We spoke first with Joan Coffman, CEO of St. Tammany Health System, who talked to us about a larger program outside the hospital. It's a community initiative called Healthier North Shore. Next, we're going to talk with Ann Pablovich, and Ann is going to tell us about the Be Well Bus. So welcome to the show, Ann.
Thanks for having me.
And I love the name Be Well Bus. It just bounces right off your tongue, and it sounds like a lot of fun.
It is a lot of fun.
But
and
it's
yes,
bigger
very
than
catchy.
that, too. So tell me what the Be Well Bus is.
So the Be Well Bus is our mobile screening unit. We bring it out into the community. You know, the name of our game right now is early detection and prevention. And so we're trying to break down barriers by bringing these resources out into the community to make it as easy for people to access these services and screenings that we can offer, so that they can know the status of their health and take action early on.
I think it's interesting. We always say know your numbers, and if you don't have an established primary care provider and you're not going to see that primary care provider once a year in their office, you probably don't know your numbers. And it's really important for us to kind of get an idea of what our blood pressure is and maybe have a heart screening. And then from a cancer perspective, there are 5 major cancers that we want to be screening for and detecting early. Isn't that right?
Absolutely. So while we can do a vast array of cancer screenings on the bus, we're not limited to that. So there's a lot of capabilities there. We can do some carotid ultrasound, some AAA, which is an abdominal aorta ultrasound. We can do blood pressure screenings. We could do EKGs on the bus. The possibilities are really, really endless. But the cancer screenings, as you mentioned, we are fully equipped to do mobile mammography on the bus. So getting your mammograms are easier than ever, and it is a 3D mammogram. So the same technology that you would have at our women's pavilion is capable on the bus. Those images are fed to the fellowship-trained breast radiologists that are at our women's pavilion. So you're really getting, it's like an extension of the services there.
So you get the convenience of the mammography on the bus, wherever the bus is going to be at my convenience.
Absolutely.
But then the person who's reading it actually is at the women's pavilion, the center of excellence.
Absolutely. So you have that full level of expertise and top-of-the-line technology.
Wonderful. And then obviously the mammography machine is permanent in the bus, but you don't use it every time you take the bus out, because sometimes you're going to see an audience, say a gentleman's group.
Absolutely.
Maybe the Knights of Columbus as an example. They probably could care less that this bus has mammography.
They're impressed by it, but they're not using that service. So other screenings that we can offer, we can do prostate cancer screenings, we can do skin cancer checks, head and neck cancer checks. We could even do cervical cancer screenings. And then there's assessments that we can do for lung cancer risk, which we would then refer to our outpatient pavilion to have a screening there called a low-dose CT, which detects cancer early on.
Okay, so it sounds like all of the major cancers, we have ways that we can go out into the community and do some initial screening, or at least have conversations that lead us to understand that we need to refer someone.
Yes, absolutely.
And the idea behind that bus is really being able to take those clinical personnel out into the field. And obviously you can't just drive up, park, and open the door and see who shows up. There's a lot of planning and logistics involved in that. And I know that's been your focus and what you're doing with the bus. Can you talk a little bit about the types of places you're going?
Absolutely. So we are on a rotating schedule. So we are at one of our clinic locations once a week. It's every Wednesday. You can check our website to see what that schedule looks like.
And that's
bewellbus.health. So mammography is the primary screening that's offered on Wednesdays, but we are able to offer other services on those days as well. Other areas that we're going to go to are employers for employee health fairs, which is a really great service because you're able to provide not only just those biometric screenings, which a lot of folks offer, which is phenomenal because you're engaging the patient and the employee on what their what their status is, but then we're able to expand upon that and offer things like mammography, make it as easy for these people to get these screenings done in a place that's convenient but still high quality. So we're combining different screenings, offering more services just to expand on those existing programs. Other places that we're going are community events, and so you'll see the bus out at some of our established community events, and we're also creating new events. So we're really trying to be out in the community everywhere we can be.
Well, fantastic. So I hear you saying that that bus is in predictable places, like in the parking lot of a primary care clinic on a rotating basis.
Yep.
So if a patient is seeing their primary care physician who's going through their annual physical and they say, I see you haven't had a mammogram, the bus is in the parking lot today, when you like to just knock that out and be done, and that's a very motivating factor to get their health care.
Absolutely.
And then similarly, to be in the parking lot of a major employer in town, that enables everyone who works there to take care of things like a cancer screening or carotid artery. Depending on what that population needs, you're going to bring that level of staffing with you on the bus.
Exactly.
And then I love this idea with the community events. So for example, once COVID allows us to keep having events again, maybe, for example, the White Linen Night that Covington does, if the bus is parked there and it's a hot night, and white linen or not white linen, you're still hot, you can get overheated. And to be able to visit the bus and hear a little bit about how to cool yourself off and take care of yourself and be aware of signs and symptoms of heat stroke.
Absolutely.
That's an education opportunity for the bus in the community.
And that's another important part, because everywhere that we're going to go, we plan to do educational outreach so that we're maximizing our impact and really spreading the word for a variety of reasons.
Right.
Vaccinations are another thing that we've done recently, trying to help with this most recent wave of COVID. We've seen a lot of businesses say, can you come and offer vaccines for our employees? And so we'll staff up and go out and welcome anybody that wants to take the opportunity to get the vaccine if they haven't yet. And that's been very helpful, I think, to a lot of employers. You'll see us out and about. You see our Facebook posts where we're offering those, and we're going to continue to do that.
Fantastic. And I think, to your point, being able to take the Be Well bus to an event or to an employer or other public place, in a lot of cases we have people in our community who haven't bothered to get the vaccine yet. It's going to take an appointment. It sounds like it's going to be too much trouble. They may have to take time off of work to get it done. If they can just get on the bus and get their shot, that's an easy way to do their part to keep our community safe, to reduce risk for themselves and their family. And the vaccine is there and convenient on the Be Well bus.
Yep, no appointment required. And that is, we've seen that time and time again. People just don't want to take the effort to call, make an appointment, take off of work, just as you said. So if we're, if we've got it in there, the course of their natural day, and it's an easy decision for them to make, then that's one more person that we're able to help and help protect our community.
And every vaccine adds to that herd immunity and
yes.
makes us all safer as a community.
Absolutely.
Well, that is beautiful, and I'm so grateful to you for being here to talk about the Be Well bus, and I look forward to seeing the beautiful Be Well bus around town.
It'll be out.
Thank you.
Thank you.
You're watching Healthy Living, brought to you by St. Tammany Health System. I'm your host, Melissa Hodgson, and we're talking today about community resources. Up next is Erin Strain, who'll teach us about corporate health solutions. We'll be right back.
Just this morning, optimism and strength prevailed. Many hopes became reality at St. Tammany Health System. Dedicated to more little miracles. And the bigger ones, too. One of many reasons we're number one.
Welcome back to Healthy Living. I'm your host, Melissa Hodgson. The show is brought to you by St. Tammany Health System. We're talking today about community health resources. We learned about A Healthier North Shore, which is a community-wide initiative from St. Tammany into Washington parishes, from Joan Coffman, CEO of St. Tammany Health System. And then we learned about the Be Well bus, which is a mobile health unit from St. Tammany Health System, from Ann Pablovich. And next we're going to hear from Erin Strain, who's with us to talk about corporate health solutions. Erin, welcome to the show.
Thank you for having me.
I'm excited to have you here. You've never been on our show.
I have not.
And Corporate Health Solutions is a part of St. Tammany Health System, and it has a focus on employers. So tell me, I guess big picture first, what is Corporate Health Solutions?
So St. Tammany Health System did a really good job. We've had this program for about 15 years. So 15 years ago, they recognized the need to make sure that we were being more of a resource to our community. And what better way to do that than to reach people where they are at their place of employment. And so we were able to help employers to navigate our health system. I mean, if you're not in the healthcare industry, it can be very daunting. And so we were able to help them with their occupational health needs, their workers' compensation needs should that arise, and then their general health needs. So let us help you keep your work staff healthy.
Wow. Okay, so I get the big picture, and I like that it's 15 years old. I had no idea that the program had been around that long. Who's eligible? How do people or companies become eligible for Corporate Health Solutions?
Any local company in this area is eligible. There's really no requirements, and some companies choose to use different pieces of the program. So not every employer will use every piece. Some just want general help with their general health needs. They want us to come in and talk to their employees about what resources we have at the hospital.
Okay, so it might be, like you said, it could be occupational health, it could be workers' comp, but from a general health perspective, you can actually go on site and do lunch and learns about quitting smoking, or have someone come talk about healthy eating, or knowing things about signs and symptoms of stroke.
Yes.
Any of those kind of things.
Yes, so we actually, we are the connector for the hospital resources. So the person in this position would make sure that if the employer had a specific need, that we were able to connect them with the correct hospital resource. And then yes, we do like to meet them where they are, go on site, do a lunch and learn, do a presentation, do a free blood pressure check, help them establish with a primary care physician to utilize their well visit. A lot of people don't understand that your well visit is annually and it's covered at 100%. And we're doing this all complimentary. The hospital has said, this is a community need, this is a way we can be of a resource to you, and we don't charge them for it.
Wow. Okay, so a local employer could have you come talk with employees about healthy choices, but you could also bring the Be Well bus to do some screenings or vaccinations or things like that. And you can individually work with those employees in that business to get them lined up for care that their health insurance that their employer provides would cover.
Correct. So
That's amazing.
More recently, we've actually had Dr. Michael Hill do some vaccination webinars for a lot of the employers in the area, and then we'll schedule the bus to come out afterwards. So we're giving them the information and the education they need on the vaccine. He's so good too. He's not at all the hard sell and the pushy. He really just wants people to understand. But because of that, we've had people actually get vaccinated. And like I said, we'll meet them where they are. We'll bring the bus out to them. It's all very seamless.
Wow. Well, I like that, how nimble that is. You're talking about a 15-year-old program that has been, in its history, very focused on occupational health, workers' comp, those kinds of things, how to keep your workforce healthy. And now, elbow deep in the midst of a pandemic, we have this terrible situation where misinformation has caused people to be afraid to get the most effective solution to COVID, which would be a vaccine. And so Corporate Health Solutions can bring an expert, a local respected expert, to speak directly with a group of employees, and you have the added benefit of the Be Well bus being there ready to go ahead and put that vaccine in the arms of everyone as they feel comfortable to do so.
Yep.
Oh my gosh, I love this. That's the logistics of it are just beautiful. It's very seamless, and I think making it easier for local St. Tammany employers to add a benefit to their staff and to help their staff use the benefits they have, which generally we all have health insurance, but sometimes we don't do a good job of using what the health insurance has to offer.
Right.
Okay. Well, you mentioned that there's no cost to it, which I love.
There isn't.
And that's a commitment on St. Tammany's part. But our partner, Ochsner Health, also has a component and can help out with Corporate Health Solutions. Can you talk a little bit about how the partnership brings the benefit?
Yeah, so through our partnership, we're able to further augment what we were previously offering our employers. So we are now talking to our employers about a digital health solution. So do you have a high population base in your company of employees who have, uncontrolled diabetes or hypertension? Can we bring that solution to you? Can we talk to you about what that would look like for your staff? Can we talk to you about the virtual health clinics? So sometimes you'll have employees that are sick or unable to get to the doctor, and it may not be that they're contagious or they're, I don't want to say too sick, but this is an option to have this clinic. It's amazing. It's actually an iPad and a bunch of different peripheral devices that could take your temperature, listen to your heart sounds, do a blood pressure check, and you're actually able to have a virtual visit with a physician without leaving your place of employment.
Oh my gosh.
So yeah, if you're having a headache or you're just, whatever it might be.
That's really amazing. I'm thinking about, in some situations like at the hospital, we have an employee health department and we have an employee clinic. So if people need something, they can be seen. But that's because we're a hospital.
Right.
If you're a printing company or you're a retail establishment or, you're any number of other types of doctors offices, lawyers, et cetera, to be able to have this piece of technology resident in the office, then people can get themselves checked out by a health professional.
Right.
Through Corporate Health Solutions.
And the whole goal here is to help employers control their cost. So every year, healthcare premium costs are rising. So if we can help you control the health of your population health movement, and keep them healthier, your costs are not going to rise the 20% or the 35% that you might see if you have a more sick population. So the digital solutions through hypertension and diabetes, the virtual health clinic, and then offering them some of our ACN products. So making them aware of, through our partnership, we have, a very robust physician network on the North Shore, but there are products that if you choose to limit your physician network a little bit, you could save some premium dollars as opposed to going with the PPO plan. So we're also able to offer that through Ochsner.
Oh my goodness. So I'm just the whole idea of Corporate Health Solutions, I feel like next time we need a show just about Corporate Health Solutions.
I would love to
amazing.
come back just for a show.
You have occupational health and you have workers' comp and you have general health services. You are there to talk to groups and talk about making healthy choices, but through the partnership too, you're talking about bringing healthcare into the workplace, and particularly using technology, digital and virtual options. The whole thing is just amazing. I'm so glad you came to talk to us today.
Thank you for having me.
You've been watching Healthy Living, and we've been talking today about community health resources. We learned about the initiative in Washington and St. Tammany parishes called Healthier North Shore. We learned about the mobile health unit called the Be Well Bus. And last, we learned about Corporate Health Solutions from our guest, Erin Strain. Thanks for joining us on Healthy Living. We'll see you next time.